This talk is about sitting down and part of a series on therapeutic communication for psychiatrists. For a psychiatrist, sitting down is an essential skill in therapeutic communication, particularly in hospital settings where patients are often lying down in beds. But why is sitting down important? To find out, let's review what sitting down does for both the patient and the psychiatrist. First, sitting down brings you down to the patient's eye level. This places you at an equal level with the patient, both literally and metaphorically. It also ensures good eye contact, which allows for effective nonverbal communication. Much of nonverbal communication occurs through microexpressions, which are small, brief changes in a person's eyes and facial expression. Maintaining consistent eye contact keeps you attuned to these microexpressions. Second, sitting down affects power dynamics between the patient and doctor. Hospitalized patients often feel vulnerable due to feeling sick and weak, as well as having reduced control over what happens to them. Meanwhile, doctors can often appear threatening or intimidating due to their status, their education and vocabulary, the amount of control they have over the patient's health, and so on. Furthermore, standing over someone is physically intimidating in general. Sitting down reduces perceived power differences and increases the patient's comfort and willingness to speak freely. Third, sitting down changes the patient's perception of how much time you've spent with them. In general, when the doctor sits down, patients perceive that the doctor has spent a longer time with them, even when the actual time spent with the patient is the same. This is important because the longer the amount of time a doctor spends with the patient, the more satisfied the patient is with their care. Next, sitting down helps the doctor to slow down. Sitting down makes the patient interaction feel less rushed, and the doctor may actually feel less rushed themselves. And doctors who sit tend to explain things better and to check for understanding more often, both of which help to educate the patient on their care. Finally, sitting down makes the interaction more positive for the patient overall. Doctors who sit are seen as more compassionate and are also seen as better listeners. These are the 5 major benefits of sitting down during patient interactions. So, in summary, the benefits of sitting down are that it improves rapport, improves patient understanding, increases patient adherence to treatment, and improves overall patient satisfaction. That's the end of this talk. I hope this inspires you to sit down more often when meeting with your patients. Thank you.